Today we're going to be talking about how to do a research study, and we're going to give the overview of just running a research study for yourself. So the first thing we're going to do is choose a topic, and we can choose a topic many different ways, and sometimes we read an article that we really like and we think, what if we just did this slight modification? That would be one way we would pick our topic. Another is maybe we're just interested in a particular topic and we want to do a research study on that. We might have this practical issue that we're trying to solve. We might be, trying to evaluate a theory and to see if that theory works. So these are all ways we can come up with our question, and this is where the art comes in research design. So a theory is a concise statement that integrates all that we know about a phenomenon. So it takes all of the previous research and makes a summary of it. So David Clark has a theory of panic disorder, and he thinks panic attacks occur because bodily sensations are catastrophically misinterpreted. So that's one very concise, dense statement that takes all that we know about the research on panic attacks and puts it together. So we can use his theory and then create research studies based off that theory. So, just again, that theory is if my heart is beating rapidly, I start to have a catastrophic misinterpretation. I'm dying is that maybe a thought that I might have. And then I start to feel more anxiety, which leads to a full-blown panic attack. So once we have our theory or idea that we're looking at, we go to the literature. So we always go to the literature to see what's been done previously, and that's an important component. We want to know what else is known already, and we want to identify the gap in that literature. So if we were looking at Clark's theory of panic, we're going to look at what else has been written about panic attacks and what do we know so far about it, and we're going to identify a gap that isn't known in the literature and try to figure out that gap in the literature. So once we find the gap in the literature, we're going to formulate hypotheses, and this is our research hypothesis. This is our best guess of what's happening in that phenomenon. So hypothesis in the book, it labels certain things that you need in this. You need a if-then, so often if a person has a catastrophic misinterpretation, then they'll have a panic attack. So we lay out our hypothesis and then we create a study from it. So this is an important concept, operational definition. And the way that I think about operational definitions is like a recipe. And we want to operationally define everything we're doing in that study so another researcher could follow it exactly. So quite often with our population, we'll identify it. We'll talk about older adults. We need to define what an older adult is. We need to define exactly our methods, our procedures, so somebody else could follow it exactly. So again, this is a kind of a review on hypothesis. We'll have our research hypothesis, and this is our best guess of what's actually happening. But then when we do our research study, we set up the null hypothesis. So the null hypothesis is that statement that nothing is happening, and we're trying to knock down that null hypothesis. Sometimes in different textbooks, they'll talk about an alternative hypothesis, and that is what you use if you knock down the null hypothesis. So if we knock down the null hypothesis, then we'll accept our alternate hypothesis. And usually the alternate hypothesis is just our research hypothesis. So I got this grayed out. I'm not going to use that term very often. Probably never again, but I just wanted you to know what that is. And it's denoted by H sub A if you do see that. All right, so again, our null hypothesis is what we're testing. We put out this null statement, and we say that our goal is to knock it down and to say nothing is happening. So we can either reject that null hypothesis or fail to reject that null hypothesis. That's all we can do. We can't accept that null hypothesis. And in later weeks, we're going to talk more about some of the problems with null hypothesis testing, and that's going to be one of them. We can't ever say nothing is happening or that there's no differences. The way the null hypothesis is set up, we can only reject it or fail to reject it. So if we're trying to show two things as being equal, we can't do that with this type of testing. All right, so now we've got our research question. We went to the literature, we found the gap in the literature, and we've created our hypotheses. Now we're ready to create our study. And one of the things that we'll do when we create our study is get informed consent from the participants. And this is a very similar to informed consent in therapy. What we want to do is to tell them what's going to happen to them in the research study, and it's a conversation. It's we're informing them, and then we're seeing if they want to be part of that research study. We're not going to tell them our research hypothesis. We don't want to give that away in case it biases them in the study, but we want them to know you're going to be taking a bunch of questionnaires, we're going to be picking blood, whatever we're going to be doing, we want them to know what's going to happen to them in the study so that they consent to be part of it. So this is these are some research ethics, and this goes with informed consent. And the big component here, let me make this a little bigger, is that people understand what they're going through. So that it's the consent process, it's a conversation, and anything that they're reading in written form has to be understandable, and they have to really understand what they're getting into. So these are our research ethics from the APA Ethics Code. The American Counseling Association has a very similar ethics code that go through what it takes to do research. All right, so I'm going to talk about variables, and variables in general are anything that can take on a value, and I'm going to talk about different types of variables and kind of break it down into dichotomies of variables. So our first dichotomy of variables, we'll talk about categorical variables and continuous variables. So categorical variables are things that take on a whole value. I think of it as groupings. So you're in one group or another group. I have here gender listed. Gender is often listed as a dichotomous variable in many research studies, and so, but in other research studies, it's considered a continuous variable, and we look at the whole spectrum of gender. So gender I have listed here, but I easily think we could, in many studies we see it as a categorical variable. It's a male-female categorical variable, but it can be continuous. So I put that here, but depending on how the researchers measure gender. Political affiliation. Again, it's probably a spectrum, but if you mark it on a survey, you're marking what party you belong to or where you are on that spectrum. So you're in one group or another group. You're not a certain amount of it. Continuous, on the other hand, is where you can take on certain amounts of that variable. So if you're how liberal you are or how conservative you are, you're putting it on a spectrum. So that would be the difference. So if we move political affiliation as a continuous, we'd be putting it on a spectrum of liberalness or conservatism. So I have got some examples here. Reaction time, you taking on any value of reaction time. Height, you can take on any value. It doesn't mean you have any value. It's you have a set value, but the range of values that people can take is continuous. Okay, the second, and this is one of the most important things you'll learn in research methods, is independent variable versus dependent variable. And the way that I think about this, I always think about the dependent variable first, because that's just a little bit easier, and that's the outcome. So the dependent variable depends on the independent variable, and the independent variable is what we manipulate. So dependent is the outcome, it depends on what we manipulate, and the independent variable is the cause, or that's the what we're actually controlling, and that's our manipulation. So we often talk about this in experimental type of studies, independent variable, dependent variable. We can use these terms in correlational studies. We talk about the cause and the effect. So with independent variables, we'll usually have at least two levels. So often when we're talking about independent variables, we're talking about a categorical independent variable. And then, so you're in one group or another group is two levels. You could have three groups, you could have three levels. So we're manipulating one thing, what group people are in, but then we'll have different levels of that independent variable. So we'll use research to guide us on what independent variables to use, what manipulations we use. We want to have good comparisons. So if we've come up with a new therapy treatment, we'll want to compare it to maybe what's been done before, or we'll compare it to a control group. And picking our comparison is really important, because if we pick it to a control group that does nothing, that's giving us the most chance of finding our new treatment does something. But if we compare it to an already existing treatment that works well, then we're able to say, does this work better than existing treatment? And so maybe we'll just include both control groups, and we have three levels to our independent variable. So our dependent variable, again, is our outcome. And when we're looking at our dependent variable, it's often continuous. And I'm going to give situations where our independent variable is continuous and our dependent variable is categorical. But for now, if we think of it as in simple experimental terms, the independent variable is often categorical, so we're in groups, and dependent variable is often continuous, so we have a certain amount that you take on. So if we're looking at treatment, we might be looking at depression as our dependent variable. We can take on multiple amounts of depression. It's a continuous variable. We could have anxiety as our outcome variable, as our dependent variable. So we want our dependent variable, we want it to be operationally defined so that other researchers can follow it. So if we're measuring depression, we might want to use the Beck Depression Inventory or something that others can use. We want it to have a low floor and high ceiling. And when we talk more about test creation, we'll talk about this a bit more. But for example, depression, we don't want it just to be for clinical patients that it's so high that you have to have a clinical amount of depression to get any score on this measure. So the Beck Depression Inventory measures, on a score from 0 to 18 is a pretty normal range of depression. But then from 18 to 40 some or 60 some, I forgot what the top end of that is, but that's pretty much a clinical range. So it's got a low floor and a high ceiling, so we can show change in this measure. Some other measures, though, that I think are important to look at is not just self-report measures. We might look at behaviors, and if somebody's depressed, we might look at a behavior such as eye contact, how often they're looking at us, or so frequency. So how many times do they look up and give us eye contact? How much time in between each eye contact? How long was the eye contact, etc. So we can look at behaviors, and I think those are important dependent variables that are often overlooked. So when we pick our dependent variable, often for each question, we'll only have one dependent variable. So, maybe we're looking at a treatment study and we're looking at outcome of depression. And then another question is, how does it change anxiety? So we have two questions and then two dependent variables, one for each question. There are multivariate methods, and multivariate methods are often when dependent variables are combined. So we could look at depression and anxiety together as sort of a combination negative affect variable. And that's a multivariate method. We're not probably going to talk a great deal about that anymore in this class, but just so you know that we can combine dependent variables and have multiple dependent variables. Again, I mentioned behavioral measures, but we could also measure reaction time, so motor responses. So we display things on the screen. We can measure how quickly people respond. The implicit association task gets at that, how quickly we respond to categories, and that gets at sort of our gut reaction of things. So that's another good dependent variable that we might use besides self-report. Physiological measures, we can measure heart rate, skin conductance. Used to need to be in a laboratory for these, but a lot of with devices now we can measure this, measure heart rate variability and heart rate throughout the day, and we can measure it with pretty simple devices. Again, self-report measures might be another dependent variable, and then behavioral measures. I've kind of spoken about both of those. All right, so here's another important concept for the quiz maybe, or just in general for research methods: random selection versus random assignment. So these terms get sometimes confused. Random selection is how we pick people to be part of our study. So when we're picking our people, we want to get as random of a group of people as possible to be part of our study. So if we're looking at voter behavior, we don't want to just go to our neighborhood and ask them, what do you think of these candidates? We want to canvass the whole area where these voters are voting. So we want to randomly select voters. And in a lot of these polls, they try to randomly select people from many different groups, not just a convenience sample. What random sampling does for us, and I don't have this on the slide, it helps us generalize to different groups of people. So if we're only doing a select group of people, we can't really generalize to everyone. So the better our random selection, the better we can generalize our study results. Random assignment is once we have the people. If we're assigning people to a group, we want to randomly assign them to groups. And this limits bias, so we don't bias where we're putting people. If we let them choose where they're putting themselves, it might bias the results. So random assignment reduces the amount of bias. Random selection allows us to generalize our results to others. So they're very different components, and sometimes they're just confusing terms because they sound pretty similar. All right, and this is just a little graph to kind of show us what we're going to look for is the population, all the people we're interested in. We're going to randomly select from the whole population if we're doing a perfect study. Then once we have our sample, we're going to randomly assign people to the groups, and that helps us helps us reduce bias. And then if we do all of these things, we can generalize back to the population. All right, so multiculturalism, in the book it talks about how it's important to randomly select people from many different populations. And of course this is important. We want our study to generalize. I think even more important is we want to look at how group affiliation might affect our results. So not only do we want to generalize an average to everybody, we might want to see how different groups are affected by whatever our intervention is. So I've got here a few articles that might be interesting. Slate years ago, they were actually discussing this Journal of Pharmacology, and they were looking at how some of the constructs we use might not even be specific enough. So they were looking at race and how it affected pharmacological medicines, and race in people who are Black, race wasn't even the best specifier. We had to get even more specific in genetics. So this is talking about maybe we need to look at our groupings and maybe even look at more specific groupings. On the other hand, maybe we might look at things like race, and maybe it's not even a genetic issue, it's a social construct. And when we talk about health disparities, we often talk about race or ethnicity and the health disparities that certain groups don't have access to health care, for example, or certain groups are getting sicker on average on specific diseases. And this health disparity research has not found a good genetic explanation for the differences between race and ethnicity. Rather, it might be more of a social construct and things that are happening socially to different races. So when we look at race and ethnicity, we don't want to just say it's a genetic thing that we're looking at. We want to look at whether it's a social construct as well. So I think multiculturalism is not just important in how we sample our participants. It's important to everything we do in our research. And I think I think the book's talking about, that we can generalize the results to everybody, but I also think it's important that we can look at differences between the groups, and things that I mentioned earlier, like gender. When we're breaking it down into a dichotomous variable, we might not be, you know, looking at it in the proper way for people who don't identify as male or female. We might be missing out on important information. Things that we look at in therapy. Maybe certain types of therapy might be better for different groups of people, and that could be related to stigma, or it could be related to many other things. So I think that when we're looking at research, we want to always keep this in mind at every aspect of our study. We don't want just to look at it in sampling, and I think the book talks a lot about just looking at multiculturalism and sampling, but it could be in our measurement. For example, constructs are different across different cultures. So in Japan, social anxiety, there's a Kayun Junfishu, I know I didn't pronounce that properly, another type of social anxiety where it's also about embarrassing others. So if I'm speaking to somebody and I embarrass that person, that's also my social anxiety. I don't want to embarrass others. So social anxiety as a construct is a little bit different for cultures like Japan. So when we're measuring things, we don't want to just assume it's the same for each culture. It might be different constructs, and it might be made up of different components within those constructs. So we want to look at everything. In measurement, we want to look at things differently. We want to look at just different outcomes. Does this outcome differ for different groups? And so I think that when we look at our research studies, this is something we have to keep in mind throughout the study.